Electrolyte balance is a fundamental physiological process essential for cellular integrity, organ function, and survival. Electrolytes are substances that dissociate into charged ions when dissolved in body fluids. These ions regulate fluid distribution, osmotic pressure, acid-base balance, neuromuscular excitability, and cardiac conduction. Electrolytes are distributed between the extracellular and intracellular fluid compartments, and even minor disturbances can precipitate life-threatening complications. For nurses, understanding electrolyte balance is critical not only for routine care, but also for managing critically ill patients, postoperative patients, and those with renal, endocrine, or neurological disorders. The major electrolytes in the human body are broadly classified into cations and anions. The primary cations include sodium, potassium, calcium, and magnesium, while the major anions include chloride, bicarbonate, and phosphate. Each electrolyte has a specific compartmental predominance and physiological role. Sodium and chloride dominate the extracellular fluid, whereas potassium and phosphate are primarily intracellular. This compartmentalization is essential for maintaining membrane potentials, cellular metabolism, and fluid equilibrium. Any disruption in this distribution directly affects cellular and systemic function. Sodium is the most abundant cation in the extracellular fluid and is the principal determinant of plasma osmolality. It plays a pivotal role in regulating water balance, extracellular fluid volume, and blood pressure. Because sodium does not freely cross the cell membrane, changes in serum sodium concentration directly influence water movement between compartments. An increase in sodium leads to water retention and expansion of extracellular volume, whereas a decrease results in fluid shifts into cells, potentially causing cerebral edema. Hence, sodium balance is central to hemodynamic stability and neurological integrity. Sodium and water balance is tightly regulated by hormonal mechanisms, primarily aldosterone and antidiuretic hormone, or ADH. Aldosterone, secreted by the adrenal cortex, promotes sodium reabsorption in the distal convoluted tubules and collecting ducts, leading to water retention and increased blood volume. ADH, released from the posterior pituitary, regulates water reabsorption independently of sodium by increasing the permeability of renal collecting ducts. Together, these hormones ensure maintenance of plasma osmolality, blood volume, and blood pressure, particularly during stress, dehydration, or postoperative states. Renal regulation of sodium balance is closely linked to cardiovascular function. A decrease in blood pressure or renal perfusion activates the renin, angiotensin, aldosterone system, resulting in sodium and water retention. Conversely, when blood volume increases, baroreceptors stimulate pressure diuresis, promoting sodium and water excretion. For nurses, this interaction explains why fluid therapy, antihypertensive drugs, and diuretics must be administered with careful monitoring of electrolytes and renal function. Potassium is the chief intracellular cation and is vital for maintaining the resting membrane potential of nerve and muscle cells. Even minimal changes in serum potassium can cause profound neuromuscular and cardiac disturbances, including arrhythmias. Potassium balance is regulated mainly by renal excretion under the influence of aldosterone, as well as by acid-base status. In acidosis, potassium shifts out of cells, increasing serum levels, while alkalosis promotes intracellular potassium shift. Understanding potassium dynamics is crucial in critical care, renal failure, and postoperative monitoring. Approximately 99% of calcium is stored in bones and teeth, serving as a structural reserve. The remaining fraction plays essential roles in muscle contraction, blood coagulation, nerve transmission, and enzymatic reactions. Calcium homeostasis is regulated by parathyroid hormone and calcitonin. Parathyroid hormone increases serum calcium by promoting bone resorption, renal reabsorption, and intestinal absorption, while calcitonin counteracts this effect. Disorders of calcium balance can manifest as tetany, seizures, or cardiac dysfunction, making prompt recognition vital in nursing practice. Magnesium and chloride, though often overlooked, are equally important in maintaining electrolyte balance. Magnesium acts as a cofactor for numerous enzymatic reactions and is essential for sodium-potassium pump function and neuromuscular stability. Chloride is the principal extracellular anion and plays a critical role in maintaining electroneutrality, acid-base balance, and gastric acid formation. Alterations in these electrolytes frequently accompany critical illness and must be evaluated alongside sodium and potassium disturbances. Please like, share, and subscribe, and leave your questions as comments.